Bismillah ar-Rahman ar-Rahim. This is our new presentation, and this presentation about accreditation frequently asked questions. Okay, why we selected this presentation right now? Because simply you choose it. We make a Google form and asked you as a member inside our hostels, and you choose this one. As you see, the percentage was 48 of the staff choose the SEBA interview questions and answers. But before we are going to start this presentation, we have to know that it's 35 question and answer, and it's considered as the basis of or basic of information needed for any staff to become ready to know about main issues of quality, and at the same time he or she will be ready to answer any question by SEBA surveyor inside the facility, hostel or PHC. So we make a summary for the most important information, and we are going to discuss it with each other. So the questions and answers. Question number one, what's quality? 100% you will be asked about quality, and forget about question and answers. You have to know it as a basic information. What is quality? Quality have a lot of definitions, like free from defect, like excellence, and so on, like matching with the standard, like implementing the right things inside the facility, and so on. But the most appropriate and acceptable definition everywhere is doing the right thing right from first time and every time with continuous improvement. This is a very simple, short definition of quality, and it's acceptable by all peoples everywhere. It's very nice and a very simple definition of quality. Question number two, what is accreditation? You have to know about accreditation because your facility is applied for accreditation. So you have to know what's the definition of accreditation. Simply, accreditation is a voluntary process in which the organization, PHC, hostel, is assessed to determine if it has met a set of standards designed to improve quality of healthcare, to make healthcare services are good and safe. So we are estimating, or we are comparing your performance with a group of standards. If you're matching with the standards, you will be accredited. If you are not, you will not be accredited. Again, there is a very important thing here, or important word here, which is voluntary. Voluntary, it's the worldwide known issue about accreditation. But here, because the people inside the Kingdom of Saudi Arabia are taking care for patient safety and for the services to become high quality services, they are making it not voluntary, it's obligatory. And there is a memo from high authority pushing all facilities to go through the accreditation process until they have the accreditation certificate by the SEBA. So what's SEBA? SEBA is the Central Board for Accreditation of Healthcare Institutes. It's a non-profit organization authorized to grant accreditation certificates to all governmental and even private healthcare facilities operating inside Saudi Arabia. So SEBA is the accreditation body inside the kingdom. They will come to your hostel, but before they are coming, they will supply you with all resources, and sometimes they will train people. They will take a member from each chapter, train them for 1, 2, 3 days, and after that they will send you a letter that they are coming to assess your hostel. Now their visit is not announced. They can come to you anytime, whatever you are accredited or not. They can come to you anytime to assess your readiness. So question number 4 is, what's organizational chart? What's organizational structure or chart? It's a chart that shows the chain of command inside the facility. It's the chart that shows the relationship between peoples inside the facility. What department related to what department, who's responsible for this one. So it's better to be done for all hostels and even two departments inside the hostel. Who's the head? Who's the departments under the main one? Is there is any division, and should be by name and title at the same time, name and title. So this is simply the organizational chart. What's the job description? Job description is a description of position applied for concerning duties, accountabilities, responsibilities, certain and certification and education required for job. Should be signed by both the staff himself and his supervisor or boss. So inside the job description, we are anticipating to find that your job duties, the qualification needed, the certification needed, and it should be signed and even stamped. If the staff did not sign it, you cannot force him to do the job. And if it's not signed by his supervisor or boss, it's not ready to become implemented. So it should be signed by both the staff himself and his supervisor or boss. So this is an example for organizational structure: the CEO, Chief Executive Officer, and some department like human resources. Inside the hostel, you will find the quality, infection control, medical director or medical services, and so on. So what's indicators? What's KPIs? Indicators are reliable and valid measures used to assess or screen organizational and practitioner performance issues, and could be number, ratio, or rate. It's a numbers or ratio or rate that we can assess the performance through it, and should be reliable and valid. So what's reliable? What's valid? Reliable means repeated measure will give the same results. Assume that we are using a sphygmomanometer to check blood pressure for some patient. If you check the blood pressure right now and it was 140/80, we are assuming that or expecting that if we repeat checking the blood pressure again within certain minutes, within few minutes, and on one condition that the clinical case is stable, we are expecting that it will be the same measure, 140/80, 139/75, 78, and so on. If we have any difference, it would be very, very small. But if you are using the same sphygmomanometer for the same patient with the same clinical condition, and you find it now 140/80, and within 2-3 minutes it's 110/70. So this sphygmomanometer, if there is no clinical condition, this sphygmomanometer is not good. It's not reliable. It's giving a huge differences between two consecutive readings. So it's not reliable. So reliable means repeated measure will give me the same result or a very close results. So this is the sphygmomanometer. What's a valid? What's valid? Valid means it will measure what it's intended to measure. Again, for example, if we are using a thermometer, we have to use it to checking the temperature, not the height, the weight, and so on. So if we are using the instrument to measure what intended to measure, it's a valid measure. Here, as we said, the thermometer and the height. What do you understand by the charging plan? What's the charging plan? Charging plan is a process of preparing the patient and his family for an effective and efficient transfer out of the hostel. We are preparing them to be discharged from our hostel to home directly or to another facility. The most important issue in the discharge planning is it should start very soon after patient admission and be liable for modification according to the patient clinical condition inside our facility. So the question is, what is a discharge plan? And the most important issue is we have to know that we have to start it soon after patient admission. What are the codes used inside your facility? Codes means we know it, but patient, visitors, and other do not know it. Because if we said, for example, there is a fire, all people inside the facility will leave their work, will leave their situation, and they come to see what's wrong going on. But if we set a code, only concerned people will come to deal with the code, and the others will not know about it. So I will enumerate it now and I explain it in a very short time, but you have to go back to revise it in your hostel because maybe a little differences between what we are saying now and some facilities. So what are the important codes? They are almost 8 important codes inside the hospital or inside the facility. Code red means internal emergency. We have a disaster inside the hospital or inside the facility, like fire, like building collapse, and so on. Code blue, we are using it for CPR, cardiopulmonary resuscitation. Code yellow, we are using it for external emergency or disaster outside the facility. Code green means code yellow or code red or code blue, finished, done. It means kill the current code. Code pink means infant abduction. If some people take an infant from his mother, from the department, from the nursery, from an ICU, it's code pink. Code white, or sometimes some facility call it code black for a bomb threat. If we find some thing or object and we are afraid it will become a bomb or blast or something like this, we will announce the code white or code black in some facilities. Code orange for chemical spill. If a chemical hazardous material is spilled on the floor, what we will do, we will announce the code orange and concerned people will come to deal with that. And at last, 8, code Mr. Strong or violent person. If we have a violent person inside the facility, of course, we have to announce the code so concerned people will come to deal with him. We will not deal with him directly because we are not trained as healthcare givers or healthcare staff. Who will do it? Security people will come to deal with him. So this is the external disaster and the internal disaster, CPR and chemical spill. What do you understand by external disaster? And external disaster, we said the yellow code or code yellow. Let's give you a brief information about any event or disaster occurring outside the facility perimeters that produce victims in numbers and type of injuries that threaten, overwhelm the facility's normal response capacity. For example, if we have tornado, if we have earthquake, if we have volcanoes, if we have huge road traffic accident, if we have a bomb threat, outside or bombardment, we have to expect that our facility will receive a huge number of injured people, different type of injuries, could be burns, fracture, wounds, surgery, and so on, even CPR. So we have to prepare ourselves for that kind of injuries and number. So people have to be there in the facility, stores have to be opened and ready. We can call the second staff people from their housing or accommodation. We have to prepare ourselves for that disaster. This is the external disaster and what we have to do for it. This is an example, a bombardment outside the hostel. We have to prepare ourselves to receive the huge number of injuries and different kind of injuries. So what about internal disaster? Internal disaster, it's inside the facility. Any event or disaster that may disrupt operation, jeopardize the safety and well-being of the occupants of the facility, or significantly cause damage to the facility, like building collapse, like fire, and so on. So what we have to do, we have to have a plan to deal with this one, code to do, and everyone have to know his turn or his role in this disaster. What do you understand by race? As we said now, if we have internal disaster, especially fire, what you have to do? Very simply, we have to do race and pass. What's race? Race is the short term for the first letter from each word. R for rescue, A for activate or alarm, C for confine or contain, E for evacuate or extinguish. So what we have to do if there is a fire inside the hostel, simply you have to say, I will do raise. What's raise? R for rescue patients, staff, and the visitor. Of course, we have to start with all the ages, with handicapped people, with children and the pediatrics, with the patients. We have to evacuate them. We have to help them. Then A, we have to activate the alarm and call the code. Code red and put the alarm. C for confine the fire or contain the fire. If the fire is in one room or in one department, you have to switch off the door, close the door, so the fire will be confined only on certain places and it will not go to the other facility perimeters. And you have to put a wet towel or wet tissue or wet curtain under the door, so it will prevent smoke from coming out of the fire areas to the other healthy areas and affecting people inside it. E for extinguish or using the fire extinguishers or evacuate this part to another part. So simply, what's raised? Rescue patients and the visitors or people who staff, activate the alarm and the code, confine the fire, extinguish or evacuate. So this is the raise. What about pass? Pass, again, it's a shortcut for PASS. P, this is for using the fire extinguishers. How I will use it? I never used the fire extinguishers. Very easy. You have to hold it, search for it. It's very close to you, and it will be arranged in different areas in the hostel according to the facility people. You go, pick it up, pull the pin, pull this pin. This pin is a safety pin. It will prevent anyone from using it if he's a child or someone don't know. But if you go to it, just you have to pull this pin. Then you have to use the hose of the fire extinguishers and aim it to the base of the fire, not the middle, not the top, because if you are using it on the base, it will stop the fire. S for squeeze the lever or the plunger, squeeze it so the material will go out and stop the fire. And last is for sweep from one side to one side, from left to right and right to left to stop all the fire. So this is pass. Pass is pull the pin, A for aim, and S for squeeze, and the second for sweep from one side to one side. What do you understand by patient confidentiality? Confidentiality means we are keeping all information of the patient confidential. No one have to know it unless the patient, or for legal issues. If the patient is awake, he know about everything, we have no right to give his information to anyone unless first of kin, his relative, someone watcher, but only on permission of the patient himself, unless he's comatose or something like this, or legal issues, they can ask us for patient information. So patient information should be kept safe. No one have to know what's going on with the patient. What do you know about OVR? OVR, it's an unusual happening, incident report or incident. Incident is unusual happening which is not consistent with the routine processes inside the facility. It's a violation of norm. Any violation of the norm inside the hostel, we have to know its incident and we have to fill an OVR. And as you know, we explained it, I think 2 weeks back on the risk journey. We explained how to fill, how to categorize your OVR. When would you submit an OVR? When? Some people will ask, I don't know when to fill an OVR or to report an OVR. Simply, I will give you a very small hint about the areas or situations you have to fill OVR. Required circumstances, disruption of facility function on undesirable events, obvious violation of policies and procedures, even that may result in injury to patient, staff, or security breach, hostility of staff, patient, or relatives, and loss of valuable things or a medication error. Example for this, if you find, can you see here? Using of extensions is not allowed because this one is very, very dangerous. It can lead to fire. It's very dangerous to do like this. So if you find at any places in the hostel, just you have to take an OVR form, fill it, give it to your supervisor. This is a wet floor. Can you allow wet floor in your facility? No. If the people of the cleaner putting the yellow sign of wet floor and they are taking care for it, it's okay. But if they are leaving it like this, anyone is liable to slip and get hurt. So what you will do, you have to fill an OVR. Again, if it's very dirty places, you have to put OVR. If one staff is not putting gloves while watching or giving service to the patient, you have to give OVR. If one is not putting a mask while dealing with a patient inside OR or for infectious patients, you have to put an OVR. If someone is not completing his medical record, you have to put OVR, and so on. What's MSDS? Material Safety Data Sheet. What's MSDS? Very simply, Material Safety Data Sheet supplies you about full details, information on a chemical and the hazards to promote the safe handling of hazardous materials and waste in order to minimize the potential of spills or leaks or other situation that might cause harm to the patient or visitor, staff, or damage their property or release to the environment. Again, for example, if there is a chemical material, and this material is, you are storing it in some place, you have to know every single information about this material, because this material, if it spill, it can affect people or the building itself. So you have to know about it. So if the nursing station having a room, they are putting some chemicals or materials there, the main stores in the hostel, the pharmacy, and or the lab, if they have any chemical materials, they have to keep an MSDS for each material. So how to deal with those materials if spills happen. This is the MSDS, for example, for some materials or information, product identification, what's the composition, how to deal with this material if a spill, how to store it, circumstances of dealing with every single information you will find about those materials. What's hand hygiene? Hand hygiene is the general term. It's a very big term, referring to any action of hand cleansing, like wash, rub, care, plus keeping nail short, no watches, no jewelries, no nail polishing, and putting the gloves when you are taking care for a patient. So hand hygiene is the general term, it's the huge term, it's the big term. It's bigger than wash. So wash is the small, but hygiene is the big. Hygiene means wash plus keeping your nail short, don't put watches or jewelries while you are taking for patient, or nail polish because it's liable for infection. So keeping your nail short, no nail polish, and putting the glove. Let's go for hand wash. When you have to wash your hands, simply if it's soiled, visible, you can see it, dirty or soiled, and the 5 moments. What are the 5 moments? Very, very simple. 2 before, 3 after. Again, 2 before, 3 after. Before patient contact, before aseptic task, after body fluid exposure, after patient contact, and after contact with the patient's surroundings. I believe all of us know about this one. You have to keep it in your mind. You have to memorize this one very, very well, because it's a frequent asked question by the SEBA surveyor. How do you wash hand properly? How you make sure that every single part in your hands washed properly? You have to wash it in a sequence. You have to follow the sequence, and my advice is go back to infection control department and ask them to give you a brochure about how to wash your hand properly. I'll give you it in simply here. Wet your hands with water, apply enough soap to cover all hand surfaces, rub hands palm to palm, right palm over left dorsum with interlaced fingers and vice versa, palm to back finger interlaced, back of the fingers to opposing palms with finger interlocked, rational wrapping of left thumb clasped in right palm, vice versa, rotational wrapping backwards, forward with clasped finger of right hand in left palm, vice versa, rinse hands with water, dry roughly with a single-use towel, then switch off your tap or faucet by a towel, not by your hands or by your elbow or by your head, whatever you like. So this is how to wash your hand properly. Next question is, what's a nosocomial infection? Nosocomial infection is infection taken by the patient from your facility. He did not present at the first time to your facility with infection. He's coming to something and he developed infection because of your facility. So infections are considered nosocomial if they were not incubating or present at the time of hospital admission, and if they occur after admission or even within 10 to 30 days after discharge from your hospital, it's considered a nosocomial infection. What do you understand by standard precaution? What you have to do to avoid infection to yourself, to patients, to visitors, and to everyone inside your facility? Consider every person, patient, or staff are potentially infectious unless if you do all those 7 things, inshallah, you will be safe and patient will be safe. Wash your hands, wear gloves, use physical barriers, use antiseptic agent, safely dispose the waste, infectious waste, sterile instruments and linens, patient isolation if needed. This is the standard precautions and is a very frequent asked question. When do you obtain a general consent from the patient? We have general consent and informed consent. What about general consent? General consent, we will obtain it during the registration process from the patient, that he is approving what we are going to do with him. Management, investigation, treatment, referral. He is giving us approval to do our job. So general consent is signed or obtained during the registration process at OPD, ER, admission. It means approval of the consent content like investigation, management, etc., etc. What's informed consent? And when we have to obtain an informed consent from the patient, informed consent is to be taken when we are going to do invasive procedure to the patient. Simply like what? Like surgical operation, anesthesia, CT scan, MRI, endoscopy, fine needle, or biopsy and blood transfusion. We have to take another separate consent from the patient. And this consent, we have to read it to the patient and we have to make him understand every single detail before signing it. Never ever ask the patient to sign a plain form. Okay, what are the international patient safety goals? I believe we discussed it separately last week in details, international patient safety goals, but here we have to enumerate them at least. It's 6 international patient safety goals. Number 1, identifying patient correctly. Number 2, improve effective communication among healthcare giver. Prove the safety of high alert medication. Number 4, ensure correct site, correct procedure, correct patient surgery. Number 5, reduce the risk of healthcare-associated infection. Number 6, reduce the risk of patient harm resulting from falls. Those are the international patient safety goals. How do you make correct documentation in patient medical record? Very simply, you have to ensure 8 points. Number 1, every single entry should be 1, completed according to information needed by the form. 2, legible handwriting. 3, you have to follow the abbreviation policy of the facility. Then you have to put the date, the time, the signature, and the stamp. And if there is any error, mistake while you are documenting, do not use liquid or erase it. You have to use the policy or to follow the policy of correcting an error inside the medical record. And I think I believe we discussed it in details in our documentation process 1 month ago, I think. What do you understand by credentialing and privileging? Credentialing is the assessment and the validating of the healthcare giver qualification to provide patient care. we have to know that you are qualified, your paper are ready, and your paper are genuine. What about privilege? Privilege means permission to provide specific medical care. We are allowing this healthcare giver to practice something inside our facility. What do you understand by clinical practice guideline? It's a systematically developed statements to assist practitioner and patient decision about appropriate healthcare for a specific clinical circumstances. There is a clinical practice guideline for hypertension, for bronchial asthma, for sickle cell anemia, for COVID-19, single disease having a clinical practice guideline, and I believe that MOH have on its website almost all clinical practice guidelines. You can take a look on them. What about central events? Central events is an unexpected occurrence involving death, serious physical or psychological injury, or the risk of thereof, and any event that might cause embarrassment or risk to the hospital with potential legal ramification and or media injuries or coverage. We have one patient. This patient died while we are taking care of him, or we caused serious physical or psychological injury or the risk of thereof for that patient. We have to do root cause analysis for them, and we have to report to MOH within 48 hours. So let's go through them. As we said, 48 hours reporting and 30 days working days to do root cause analysis. Examples for it: if we did some thing to wrong patient, invasive procedure to wrong patient, or we did a wrong surgery, or the patient had hemolytic blood transfusion, or there is a suicide in an inpatient unit, if we forget an instrument or goes inside the patient, which is retained instrument, intravascular gas embolism, major medication error lead to injury or death, maternal death, unexpected death, infant abduction, rape, collapse of the building, fire. These are the most important central events. You have to report to MOH within 48 hours and do root cause analysis within 30 days. So what's root cause analysis? Root cause analysis, as you see in these pictures, the green color is above the surface. We can see from the problem. But every single problem have roots, and those roots are covered. It's under the earth. We cannot know them until we do the root cause analysis. So root cause analysis is defined as a process for identifying the basic or causal factor that underlies variation in the performance, including the occurrence or possible occurrence of central event. What do you understand by focus PDCA? I believe we explained it in single presentation before, but you have to know that it's a methodology of improvement. Focus PDCA, it is a methodology for improvement. For focus PDCA, F for find opportunity to improve, O organizing the team, clarifying the current process, you understand the causes of the problem or the process variation and the remedies for the problem, S for selecting the most appropriate remedy or improvement, P means put an action plan, do, D for do the improvement or implement the action plan, C is checking the results by KPIs or watching, A by acting on the gains. If you have some gains, act to hold them, then generalize your improvement on other departments inside the facility. This is focus PDCA brief. What do you manage? How could you manage a chemical spill on the floor? Simply, you have to follow this one. Announce the code of the chemical spill. As we said before, if you remember that it's code orange in almost all facilities, but you have to go to revise it in your facility, what the color of the spill kit in our facility. To get the spill kit bag, there is a bag containing the materials you have to use to dealing with the spill kit. So you have to know where is the bag, how to use. You have to be prepared on this. It's a very simple issue, very, very simple. But you have to go to ask people of hazards people or the safety officer to train you on. Because if there is a spill of a chemical material and you touch it with your hand, can you guess what's going on? What will happen? Or a visitor or a patient, so you have to be trained on this. 3, wear the protective clothes. It is inside the bag. Determine chemical nature of the spill. How? By deal with the MSDS. If the chemical nature of the spill is not known, deal with it as a toxic or hazardous material. If the spill is as toxic or hazardous material, evacuate patient or people or visitors all from this area and ventilate the area at last. This is the and how we deal with. What's the difference color codes for waste management in your facility? It's very easy. Almost on all we have 4 types. Sorry, it's written here 3. It's 4 types. Okay. So non-infected waste, we will use the black bag. For our tissue, for our food, the rest of food, paper, we will put it in newspaper, whatever, we will put it in the black bag. If it's infected waste, we will put it in the yellow bag, like cotton, like goes from a dressing, we will put it inside. Sharps, we will put sharp objects inside the sharp container, like needle, like scalpel, and number 4, it's written here 3, but it's 4. The pathological waste, we will put it in a red bag, like blood bags, like tissue, like organs, like placenta, we will put it in the red bag. This is according to SEBA. We'll put the black or white for non-hazards, and yellow for hazards, red for human parts, and puncture resistant, we will put it in the sharp. Now we have to enumerate, just enumerate some of patient family rights. It's almost 15 or more. We will mention here 5 or 6 some of patient family rights and patient responsibility. The patient and his family rights is to receive complete information about his hair diagnosis, squeals, prognosis, and treatment. Tell the patient what is his problem, what we are going to do. The patient have to share in his treatment plan. To refer him or her to other special higher health care center or interdepartmental unit if needed or necessary. If the patient needs a service not present in your facility, you have to push him to another facility. To provide him here with a privacy, by not performing a physical examination on the delicate parts of his or her body as it may not deem necessary. To explain to him or her about the diagnosis in manner and the language he can understand. Do not use jargons and English words during explaining it to the patient unless, of course, he knows English. To alleviate pain, you have to decrease, you have to finish his pain, you have to decrease the pain because the patient is suffering as possible as you could. To accept or refuse the treatment prescribed to him, he can accept the physician himself, he can ask for another opinion, he can refuse the surgery and select the medical treatment. To provide confidentiality about his situation and don't tell it or communicate it or disclose it to any unless with his permission. So those are some of the patient rights. What about patient responsibilities towards our facilities? To provide the health caregiver with the information needed for the treatment, to observe and follow the rules of and the regulation of the hostel. Do not smoke, do not smoke. Do not get children with you during the visiting hours. Okay. To provide respect to all hostel staff, deal with them in a respect. To take medication on times prescribed by the physician, and to come on time if we called you to come for appointment. I think we believed the 35 question. Thank you very much for listening, and until we will meet again, Assalamu alaikum wa rahmatullahi wa barakatuh.